Conflict resolution in healthcare workplaces is an essential skill. Nurses face conflict all of the time and must be able to handle these situations in a professional and effective manner. In this video, we will be going more in depth on qualities and skills nurses should have to best resolve conflict. The qualities and skills we will be discussing are teamwork, respect, being present, accountability, and critical thinking.
The first skill, teamwork, is essential to provide the best experience and outcome for patients, as well as to maintain a healthy work environment. In order to be an effective team, nurses and other healthcare professionals need to have healthy communication skills. If a situation of conflict arises, it is important to be assertive because nurses are the patient's strongest advocates. There may be situations in which nurses must be flexible and compromise with their other team members.
When solving a conflict, it is also important to be present in the moment. Stay focused on the issue at hand and put all other tasks aside while trying to figure out how to best resolve the current problem. This allows people involved in the conflict to discuss successfully with minimal distractions and allows the one speaking to feel as though they are really being heard. It is especially important to be present when speaking with patients and family so they can feel informed and that they are being acknowledged. Being attentive and a careful listener are improved if one is present when talking.
Using a respectful approach to care is also an important quality for a nurse. Nurse and healthcare staff need to ensure that their behavior constantly shows acceptance and respect to patients. Patients come from various places, have different backgrounds, religions, and cultures. It may be very hard to understand some situations without specific knowledge and experience. However, as a nurse, it is professional to always show respect to patients, and it would be very helpful to provide different options and let patients make their own decisions.
The ability to recognize error in oneself is an important component to the resolution of conflicts. Taking accountability in difficult situations shows a responsible motive when solving an issue. A positive attitude can help one get into the right mindset to consider all possible options in a situation. Oftentimes in challenging problems, professionals who are held accountable feel they are exceeding their job description. However, it is the ones who contribute and take action that get the best results. In order to successfully move past an obstacle, it is critical to remind oneself the overall goal that needs to be achieved. For professionals in healthcare, the patient is the utmost priority, and the motivation behind conflict resolution should be focused on them.
Now we're going to talk a little bit about how critical thinking relates to conflict resolution. Working in a healthcare setting, it can be anticipated that disputes will often arise. These complications in communication can have an effect on patient care, and therefore quick solutions are necessary. Critical thinking requires being able to take a step back from the situation and see the big picture in order to solve complex problems. Doing this allows us to properly assess the situation and reach a conclusion that both parties agree with. At times, critical thinking includes compromising in order to accommodate everyone's opinions involved. For healthcare professionals especially, having an open-minded and empathetic approach to resolving conflicts is crucial when using critical thinking for the sake of their patients.
All of these qualities contribute to successfully resolving conflicts, which is essential in a nursing career. In order to achieve optimal results for patients, it is crucial to have a strong team that can work together through any situation. Families and patients may create conflict at times, but it is the nurse's job to effectively communicate in a professional manner. Practicing these skills will create an environment that promotes healthy relationship building and positive patient experiences.